Howdy guys, Dr. Nathan Burrow back again. So this is going to be the second installment in that series that I'm doing. And today we're going to go ahead and branch into what is a doctor, okay? So before we do any of that, hopefully y'all enjoyed the disease video. If not, make sure to go ahead and check that out first because it's going to be the preamp thing for this because right in a second, whenever you hear the definition, you'll kind of get why. So anyway, so let's just jump on into it. So again, if you do a quick Google search, just what is a doctor? First thing that pops up for me is it's actually a three-part little definition that it says. First one is it's going to state how it's a healthcare professional that has completed a bunch of medical training and is licensed professional. I feel like that's an obvious part. Okay. Second part that it makes sure to say is there's a lot of specialties and specific things that they're looking at, which again makes sense. And the third, which is probably the most important and the reason for that last video, is the number one and only job of a doctor is to prevent, treat, and diagnose disease. Okay, so we are supposed to diagnose, prevent, and treat diseases. That's why we talked about all that stuff before. Okay, so with that said, like we said last time, diseases are very, very, very crazy widespread. There's tons of cause, there's tons of effect, there's tons of different things in the body that can be abnormal, okay? So with that said, that's why they say there's specialties as far as doctors go, is because you don't need a one-size-fits-all type person. It's too vast of a thing, okay? There's too much stuff. There's not enough for somebody to be an expert in absolutely everything. So we all have our niche in this healthcare society where we all have certain things that we specialize in, and if we can stay in those realms, usually we're more successful at actually taking care of the abnormal condition that we're trying to search for, right? Because what we're supposed to do is diagnose, treat, and prevent, right? So with that said, we all within our specialty are usually pretty skilled at the diagnostics that are inside of our own specialty, right? And because of that, we're pretty good at the treatment for it, and hopefully we can be good at actually teaching people how to prevent it too. Is that always the case? Probably not, but that doesn't matter. So anyway, the cool thing too, as far as the way we go, is there's several different approaches to the way that we actually treat, prevent, or anything like that as far as the diseases go, right? So you have different ways of approaching things, whether it's going to be, okay, do I want to go ahead and go towards the allopathic side where I'm trying to go ahead and see if I can get some medication or something like that, or do I want to go more holistic, maybe do a nutrition route, something supplement wise, or is there any rehabs I can do for this, or do I want to go a little bit more advanced and invasive? Like there's a lot of approaches, and usually the best approach really just depends on what the abnormal condition is, and that's why you have to dictate which doctor's probably going to be best for you. And it's really hard because some of the stuff we do is intertwined a little bit, and it takes a second to find that right place. So anyway, that'll be a discussion a little bit for later too. I'll get off my soapbox there a touch, but let's back up a little bit. So doctor's job is to diagnose, prevent, and treat diseases, right? So, and it's very vast. So we obviously in our first year of schooling are going to learn, all doctors at least. I'm not sure exactly what the schooling is for the NPs or RNs or PAs or anything like that. I'm not totally well versed in those, but I do know as far as doctoral programs how they work really well. So you get your undergrad degrees, all that sort of stuff, you get accepted, you go to doctoral school, and you get basically about 4 years, sometimes packed a little shorter, and then at the end, sometimes as far as like where you're going to go to, there's a little bit of a residency or something like that after. It just depends. Some are built in, some aren't, doesn't matter. Anyway, that first year, all of us learn living sciences, okay? So it's going to be anatomies, biochems, organic chemistries, all that sort of fun stuff, and we're learning how the body works, right? So we get the good basis on how everything works, and that's why we all have at least a little bit of knowledge in the sense of what's going on to an extent, okay? So we have a broad scale ability to be like, okay, something's not right. And the reason why is because then we can at least identify if something's not right. So if I had somebody come in this office that I don't know, they have some sort of weird thing going on that I have no way of treating because it's way outside my scope, but at least I can identify it and send it where I need to go, okay? So anyway, that's what the first year's been pounded of. The second year you branch into more, instead of the living sciences, it's more of the applied sciences. And those applied sciences, again, are going to be very specific for what we're going into, right? So in my case, there's really no reason for me to be jumping really, really deep into pharmacological drugs or anything like that, right? Because that's not what I do for a living. There's no reason for me to be doing a lot of kidney function type stuff because I'm not going to be dealing with renal stuff at all. I'm going to be dealing with biomechanics, making sure people are moving right, maybe a little bit of nutrition. I'm gonna do a lot of orthopedics just to rule out a lot of stuff that could be big red flags that I don't need to work on, and some rehab, PT, stuff like that. It's gonna be more based in that sense. So all of our schooling our second year goes towards that. As I could imagine, a lot of MDs, depending on the route they're going to go, are going to go vastly different than that, right? They're not going to need as much orthopedics because a lot of them aren't going to be doing the orthopedic type stuff, right? So it doesn't make sense to go with them with something like that, just like it doesn't make any sense to come in here if you're like, I think I have the flu. Like, what am I going to do, you know? So anyway, with that said, that's the second year. The third year, it tends to get a little bit more of, instead of what we're going to do, it's how we're going to treat it. Okay, so that's when we start going more into the, sorry, I was getting a phone call there for a second. We get a little bit more into the what exactly we're going to be doing for the next 30 years, right? How we're going to be going about it, how we're going to apply what we just learned. You get into the critical thinking and stuff like that, get real world examples. And I know for chiropractic, we actually go to the point where we actually start getting to treat the public and a little bit of the people that we're students with, right? You go outpatient clinic and you also get a student clinic where we kind of build our residency in a little bit. And it's because you have to have hands-on experience in order to be able to do a lot of this stuff, right? You got to build up your palpation skills. You got to make sure you know what you're looking for. And we do it under the window of the school system. That way we can have somebody above us going, hey, am I doing this correct? And they can be like, yeah, you got the right track. Or, hey, you're way off basis. Let's go ahead and try this way and help you out type thing. Because we're all learning. We're all practicing professionals. And just like anything else in life, in order to get good at something, you have to practice through it, okay? So let's back up one more time real quick. So doctors are supposed to diagnose, prevent, and treat diseases. And I'm going to keep saying that because that's what our only job is, right? It's a very broad thing, and there's a lot of different specific stuff, okay? So with that said, every doc has their one niche, okay? We can treat that one abnormal condition, or at least that type of condition, okay? Ours, again, is biomechanics, everything involving motion with the body and making sure you're moving correctly. And if you are, then you get my point. We're not going to have a lot of the stuff associated with it. Now, with that said, there's stuff I can do to treat symptomatology, and I get it. And it's because a lot of the stuff that I see, like say you come in with like some sinus congestion. There's things I can do to kind of help you open up your sinuses a little bit. Now, am I preventing you from having allergies? No, like not at all. That doesn't make any sense. But I'm at least draining the sinuses a little bit, right? Now, in other fields, and I'll just leave it at that, it's the same type of thing. If you go into somebody and you have certain symptomatology, they can do things like provide painkillers or something like that, where they're treating more of the tail end symptom, not necessarily the root cause. And like we talked about in the last video, you have abnormal conditions that are causing these functional and structural issues, right? So they're causing the symptomatology. And just like with that roof leak I was talking about, you don't want to just patch the roof, or patch the ceiling tile. You want to go up to the roof and get to the source. You want to go to the cause, not treat the effect. And in doing so, you don't have an effect because you got rid of the cause, okay? So the whole reason we go through this, and I'm gonna tail back to it a couple times, is make sure you're finding the doc that is specializing in the cause or the disease that you need to deal with, right? We need to make sure we're in the right place, okay? Now, I'm gonna back up one more time. There's a lot of different approaches, like I said earlier, okay? You have allopathic, you have holistic. We're gonna talk about that here soon. That's probably gonna be the next video. But you also have structural and functional issues intertwined inside of that abnormal condition I was talking about, right? Now, you can have times where the structural issue is what is causing the problem, and you can have times where it's actually just totally functional that's doing it, but there happens to be a structural issue there too, right? So whenever you start talking about stuff like that, one good example that I can think of is let's think about a low back injury, right? So if you have, a disc injury, right? There's times where it gets emergent and it needs to immediately go in and get fixed, right? The structural issue is causing all the symptoms. That's what needs to be fixed. It needs to be solidified. Otherwise, you're going to lose something, right? That's what the surgery is designed for, is to stop the loss of a limb or an organ or something like that, right? While there's times where if you just restore the functional state because there's a functional issue, the function was what was causing the structure to be off to start with because of all the built up pressure around it. And it put so much pressure on the body that the body started changing the structure slightly. And if you can get the function restored, then it'll come back, okay? Again, we're gonna get a little bit more deep into that because that's a very complex topic. But this is, again, why I'm doing these videos the way I am. I'm gonna probably leave this one open-ended here in a second as well, but that's what doctors do. We treat diseases, and the way we treat diseases is we have our specialties that we look at. We're very good at those. Can we help with a lot of other stuff? We can. But we need to know who we should be sending to, and you need to have some knowledge in order to know that you're in the right place. Okay? So just make informed decisions is the main thing I'm trying to get with. And we'll go ahead and continue talking about random stuff next time. So y'all have a blessed day. Make sure to like, subscribe, all that stuff, and we'll see y'all here soon. Thank you.